Hi, I am Dr. Saqib Mansoor, and this is my channel Learning Anatomy. And today I will discuss with you frozen shoulder joint, all aspects. Adhesive capsulitis of the shoulder joint is the other name of the frozen shoulder. And yes, you could see this is the thickened and inflamed glenohumeral joint capsule, right? This is the glenohumeral joint capsule, which is thick and inflamed in this frozen shoulder, right? That is called as the adhesive capsulitis of the shoulder joint, the glenohumeral joint. So let's start discussion of the frozen shoulder. Adhesive fibrosis and scarring between inflamed joint capsule of glenohumeral joint, rotator cuff, and subacromial bursa and deltoid usually cause adhesive capsulitis, which is known as the frozen shoulder. Term frozen shoulder is used to describe the painful and stiff shoulder condition of varying etiology, some of which are poorly defined and are termed idiopathic. So you here keep in mind that frozen shoulder is mostly idiopathic. So a person with frozen shoulder experiences difficulty abducting the arm and can achieve an apparent abduction of about 45 degrees by elevating and rotating the scapula. As there is lack of movement at glenohumeral joint, the acromioclavicular joint gets strained and pain can be felt there during other movements, for example, elevation or shrugging of shoulder. So what is an acute capsulitis, right? So its causes: acute capsulitis, glenohumeral dislocations, partial tearing of rotator cuff, and calcific supraspinatus tendinitis, bicipital tendinitis. One of the commonest causes of frozen shoulder is not moving the shoulder after recovering from a shoulder injury, broken arm, or a stroke. That is the immobility. So history and examination. Typical features of idiopathic frozen shoulder are spontaneous, mostly severe pain of sudden onset, and can be a result of minor trauma. Sleep gets disturbed often. Differential diagnoses include fractures, infection, and the rotator cuff tears. So history and examination continues. In early stages, examination of the shoulder is difficult due to pain, but as the disease advances, range of motion decreases, both actively as well as passively. There is local tenderness on the anterior aspect usually. And what is the pathognomonic sign of the frozen shoulder? That is the loss of external rotation, right? And it distinguishes it from the rotator cuff disease, this loss of external rotation being the pathognomonic sign. So plain radiographs are used to exclude other intra-articular pathologies. So very commonly discussed about this frozen shoulder and very popular amongst anatomists, the clinical anatomy, typical hallmark, or the orthopedics, or the physiotherapy, the stages of the frozen shoulder. So it typically occurs in 3 stages. First is the freezing stage, second is the frozen stage, and the third is the thawing stage. So number 1, freezing stage. What is that? Any shoulder movement causes pain and the shoulder movement becomes restricted. Duration of this stage is from 2 to 9 months. And the frozen stage, this pain in the frozen stage, pain may decrease during this stage, but the shoulder gets stiffer. Its use becomes more difficult. Duration of this stage is from 4 to 12 months. And the thawing stage, ability to shoulder to move starts improving. During this stage, this movement is from, the duration of this stage is from 5 to 24 months, right? Which is 2 years. So what are the risk factors of the, frozen shoulder? First of all is age and sex. People 40 years old and above, especially women, are more vulnerable to get frozen shoulder. It's more common in females. of a higher age group, the 50 years or even above, more vulnerable above 50 years. Immobility or reduced mobility. People who are to keep a shoulder a bit still are at higher risk of developing frozen shoulder. Diminished movements can be a result of many factors that include broken arm, rotator cuff injury, stroke, or while recovering from a surgery. So systemic diseases also make the shoulder joint frozen. Its vulnerability gets increased to get a frozen shoulder. These systemic diseases are, number one, the diabetes, then the thyroid diseases, whether it's a hyperthyroidism or hypothyroidism, then the heart disease, the cardiac disease, then is the Parkinson's disease. And how you diagnose this shoulder joint condition, the frozen shoulder, the adhesive capsulitis of the shoulder joint? This is a physical examination, first of all. First of all is done the physical examination. The clinician asks the patient to move his arm in various ways. It is done to check pain and observe how far he can move his arm. There is active range of motion. Then the patient then is asked to relax his muscles while the clinician moves patient's arm, passive range of motion. So here, both active and passive range of motion are affected in the frozen shoulder. Usually frozen shoulder can be diagnosed from signs and symptoms only. Imaging tests like X-rays, ultrasound, and MRI are used to rule out other problems. So let's have a brief look at the treatment. How the frozen shoulder is usually treated. Usually no treatment is needed and the condition dissolves with time, as discussed before, right? So it's a spontaneous resolution. The range of motion can be a little decreased as compared with the unaffected side, but the most of the patients have no functional problems after recovering from this frozen shoulder. Treatment in the acute stage is pain relief, right? Pain relief. So the corticosteroids can be given, but this therapy has variable effects, and it is better to avoid if imaging tests show a repairable rotator cuff tear to be present. So active and passive mobilization can be performed if comfort permits, but aggressive and painful physiotherapy is to be discouraged. So the treatment continues. Surgical treatment, it is usually done for prolonged stiffness affecting the functional, but in acute stage, it also yields good pain relief. Manipulation under anesthetic, it can bring about an increased range of motion. Arthroscopic distension of the joint with the saline, it permits inspection of shoulder prior to treatment. And we can do something to prevent the frozen shoulder to develop. So as discussed before, one of the very common causes of the frozen shoulder is not moving a shoulder when one recovers from a shoulder injury, broken arm, or a stroke, right? That is a prolonged immobility of the shoulder joint. So if you had an injury that makes a shoulder difficult to move, consult a clinician about the exercises that can be useful to maintain your shoulder joint mobility. Of course, here one can involve a physiotherapist. So let's, in the last this slide, this is the frozen shoulder summary. Let's quickly go through that summary as well. It is usually idiopathic or secondary to some other defined pathologies. Symptoms, the pain and then diminished shoulder movement, and the idiopathic mostly in females in their fifth decade, so fourth or fifth decade. Spontaneous resolution usually takes place in between 1 and 3 years. Yeah, right? There's a spontaneous recovery. Differential diagnosis, DD, calcific tendinitis, rotator cuff tear. So thank you very much for listening to this brief lecture, and very soon I will be coming with the next. So keep tuned and subscribe and press the bell icon. Thank you very much. Bye.